We are just about a minute into the start of today's edition. It's great to have all of us join early, and of course, we have in the house already uh trainer for the day. That is in the person of Dr. Wale Mobolaji. He's a professor, or call him a professor, in the Department of Demography and Social Statistics. And he is someone that we are confident will really enjoy and learn from his wealth of knowledge in Introduction to Research Design today. My name is Ola Dimeji Ogunye, and I'm happy to welcome us to another edition of the University Research Training, organized by the Central Office of Research, the Postgraduate College, and the Postgraduate Student Association for Bafemi Awolowo University Ife. We started this for a while, and we've gone through different titles and topics, and now for the next couple of weeks, we'll be looking into different aspects of research design. And for today, we have our seasoned Oga to take us through this introduction and to introduce us to why this is important and what to look out for and everything we need to know as we start this. I am not the only one here. I'm trying to see if Professor Babajide Odu is in the room already. That is the director, University Research Office. I know he's trying to join, but I'm not sure if he has been able to come in. All right. So on behalf of our guys, that is Professor Babajide Odu, Director, University Research Office, and Professor Niro Oluwaranti, Director, Linkages and Partnerships, and Professor Grace Ogunluse, the Director, Intellectual Property and Technology Transfer Office. I am delighted to welcome all of us. I'm sure all of them will join in shortly. I know Professor Odu is trying to sign in actively, so once he comes in, I think after the lecture, we'll be able to hear from him. And then from the Deputy Vice Chancellor, Research, Innovation and Development, Professor Akoni Akinyemi, we want to welcome all of us, and then we want to wish us a very fruitful and delightful time. So the way it works is that we listen to our speaker for 40 to 45 minutes. And then if you have questions, you can put it in the chat, or you use the raise hand icon. But from experience, I think you're better off typing your questions in the chat, because many times the time is almost gone by the end of the lecture. So again, I think I see Professor Morenike Upong also in the house. We want to welcome you, Ma. And then I can see some other professors joining, but then I think at the end of the lecture, we would be welcoming everyone. So welcome all of us, and without wasting our time, okay, Professor Odu is in. Please, can you make Professor Odu a co-host so that he can just give a short welcome charge, and then we can start at 8:05. Prof, I can unmute and say a short welcome to everyone. All right, sir.
Yeah, good morning. I want to welcome everybody to this Friday presentation. I want to especially welcome Dr. Mobolaji, Jacob Wale Mobolaji. Thank you for agreeing to present today's seminar. And for everyone who is already in, I think a lot of people are trying to come in now. So welcome. Thank you for attending. I believe that we have a very good time, and by the end of the day, we will be able to, have something tangible to go with. Thank you. So over to you, Dimeji.
All right, thank you very much, sir. So, Professor Mbalaji, sir, the floor is yours, and we are happy to listen to you for the next 4 minutes. Over to you, sir.
Thank you so much, Dr. Dimeji. I want to appreciate the Central Office of Research and the Postgraduate College for giving me this privilege to present this this training, or to anchor this training this time, talking about introduction to research design. I do not take the opportunity for granted. Thank you so much. So today we will be looking at introduction to research design. And of course, everyone here has been involved in one research or the other at one time or the other, one point or the other. And for those who have not probably been involved in any research, this is going to be an introduction. It's not going to be we're not going to cover everything about research design because it's so broad an area in research. So, yeah. So the learning objective in this training or this workshop this morning, first of all, we want the participant to be able to define what research design is all about and explain its importance, and then differentiate the various or major types of research designs that we have. And also, we want participants to be able to understand the strengths and limitations of different research designs that we have. And also, to be able to apply research design to your real-world research problems and develop skills in choosing appropriate research designs. So first of all, let's start by talking about what research design is all about. Research design is the overall strategy for answering a research question. It's a strategic framework that connects research questions to valid and reliable answers. So the essence of asking a question is to be able to provide an answer, but the answer is not going to be based on some guesses. There will have to be some systematic approaches that we will follow. So it's a strategic framework, a well-designed framework that leads to how you answer the question, or leads to answering of the questions. So research design specifies how your data will be collected, how it's measured, analyzed, and interpreted. So, and that is what is going to ensure the validity, reliability, and the ethical conduct of the research, and also to ensure that you make efficient use of the resources. You know, there is a saying that if research is a journey, the research design itself is your map. It's the map that takes you through the journey. It's a vehicle that you take, and it's also the itinerary that you use, and that's all combined together. So now, why does research design matter? There is a saying by Ronald Fisher, and I quote it, said, to consult the statistician after an experiment is finished is often merely to ask him to conduct a post-mortem examination. So he can perhaps say what the experiment died of. So research design, you know, from the goal, you know, set the pace, describe the process that will be followed, and it itemize various steps that are going to follow to make sure that you use appropriate design without necessarily, you know, without going into some errors or without, you know, answering the question that you are raising, you know, using an inappropriate method. So a research design is not just a technical procedure. It's foundational. And its foundation, it's foundational upon it is the foundational architecture upon which all scientific knowledge, you know, should rest. So whatever knowledge you're going to derive from your investigation, research design is the foundation of that architecture. So if in any way your research design is flawed, the implication is the knowledge you generate from that investigation will be flawed as well. Irrespective of how sophisticated the statistical analysis is, or your sample size, or even the prestige of the investigator himself. So once the design is flawed, once the design is erroneous somewhere, the knowledge produced, the findings will be erroneous as well. So the design determines what questions you are going to answer. So because it's not just any kind of design that answers all kinds of questions. So the question that you are going to answer, you know, it completely depends on your design, and also your design also depends on the question you are trying to answer. So in that case, what inference are valid or what conclusion can be generalized, they all depend on your research design. So let me give an illustration of using a case study. So let's consider two studies that are trying to examine whether a new malaria vaccine will reduce childhood mortality. Of course, we know there are several factors that could contribute to childhood mortality, but we want to see, because malaria, for example, in this part of the world, malaria is making a huge contribution to childhood mortality. So let's say study A is a well-designed cluster randomized trial with about 10,000 children across 40 villages and proper allocation of concealment, blinded outcome assessment, and intention to treat analysis. That is a study. Then another study is an uncontrolled before and after study, no control group, just the same population. You check them before and then after the intervention in a single village, and after the vaccine is introduced, you compare the mortality in the previous year to the previous year compared to, let's say, the current year. So let's assume that both studies show about 30% mortality reduction. So even though they are both showing an interesting finding, our confidence will be more on study A because it goes through more rigor. Study B cannot distinguish the vaccine effect from possible concurrent improvement in nutrition, in healthcare access, or disease seasonality. So, but for study A, so some confounding, factors, some confounders have been controlled for, and then there is a randomization, and there are some groups are controlled. So that other group is experiment group. So we have more confidence in study A. So the design determines whether the evidence is causal or just merely suggestive. So it's important that we use appropriate design in our research if you're going to answer the research question appropriately. So there are other things we want to look at as determining it is important. I hope everybody can hear me. I want to be sure my internet is stable. So, thank you. So one of the importance of research design is the causal hierarchy of research design. So, hierarchy in research. So when a third variable is associated with both the exposure and outcome, that is a confounding. And it's important that in our research design, we identify this. So when we're answering a question, it is not all research designs that can, imply causality. So there are some that would imply causality, and there are others that cannot actually imply causality. And another thing in terms of causation in research is the temporal sequence. And this requires that that the cause of a particular situation, a particular problem precedes the effect. The cause precedes the effect. So, and this is a shortcoming in a research design like cross-sectional studies, because cross-sectional studies simultaneously measure both the exposure and the outcome, measures the factor and the outcome. So, and where this happens, it cannot really establish causation. The assumption or the temporal sequence is violated in this case. For example, if you're looking at association between diabetes and depression, yes, cross-sectional can bring up this association too, but there will be an issue with temporality because the one is supposed to happen before the other. So we cannot say diabetes is the one causing depression or it's depression that is causing diabetes if both are measured at the same time. So it requires like a randomized control trial or a cohort study to be able to measure this, to be able to say that diabetes causes depression. Or of course, depression can also lead to diabetes, or it could also be a third, a confounding factor, another variable like maybe obesity that's even responsible for maybe the diabetes or the depression itself. And also the issue of general stability as well. So, and this concerns whether findings can be applied beyond this study sample or not. So if you are going to ensure general stability, so we have to, take care of the research design that we choose. Another reason research design is important is the fact that it protects against bias. So there are a lot of bias in research, but especially selection bias, which occurs when the study sample is not representative of the target population, or the comparison groups are formed by non-random process. So it's going to cause some selection bias. And whatever conclusion we're going to make from that study, whatever finding, is not going to be, is going to be biased. So, and then there could be information bias as well, which of course, when exposure and outcome measures, differs, systematically between comparison groups. And there could also be confounding bias, when, which is controlled at the design stage. So if you want to control confounding bias, it has to be at the design stage. Maybe you use randomization, or you use some matching or restriction or stratification, so that whatever actor will be contributing to, will be, confounding the findings or the associations we control for them at the design stage, not just at the analysis. It also determines the efficiency and feasibility of the investigation, statistical efficiency, the operational feasibility, analytical feasibility as well. And also, it's important, it determines the statistical validity. So if the research design is wrong, whatever statistical tool we are using, it's just going to be a waste of time, because we'll be trying to rectify the situation or remedy the situation, but it's just too late once the design is wrong. And also, it shows ethical commitment and also determines policy impact. Now, what are the components of research design? There are quite a number of aspects of research design that one need to look into. And of course, we begin from the research questions. And then you go to the literature review. So what are the existing knowledge or existing studies on what we are trying to find out? And also you make some testable predictions, your hypothesis. Then you define your independent variable, your dependent variables, the controls, and these are all of these the official definitions of the terms you're using in your study. And what research approach are you going to use? Is it going to be quantitative or qualitative or mixed method strategy? And also your research design type, is it going to be experimental or quasi-experimental or cross-sectional or longitudinal study? I'll be talking a bit more about each of these, and we're going to focus more on this design type as we continue. So apart from this, sampling design, they are all part of the components of research design. And then your data collection, how do you want to analyze data? What are the ethical considerations you are making, the consent of the research participant, confidentiality, and also you make sure you minimize harm, and you also get institutional review board approval. And what timeline do you have? What resources do you have? And what are the limitations? All of these, they are all components of research design that we need to spell out when we are defining our research. Now, research design that we choose largely depends on our research question, whatever research question we're asking. For example, if our research question is descriptive, like what is happening. You want to know what is happening. You want to have an understanding of the variable, a single variable. You want to know the prevalence, for example, prevalence of diabetes, maybe in Kenya, in Nigeria, in any other country. So you want to know the prevalence in the US. So what the type of research design you use for this is different from the one you're going to use when you are comparing groups. That is comparative, when you have comparative questions. How do groups differ? So maybe you want to compare two or more existing groups. For example, vaccination rates in rural compared to urban area. That is comparative. So the research design you're going to use for this is different from the one you use for descriptive questions. And the one you use for both may be different from the one you use for correlational questions. You want to know the relationship between two variables or two situations, two factors. You want to see the relationship between variables without directly manipulating any of the variables. So you are not carrying out any intervention. So this is a correlational question. So for example, air pollution in association with respiratory disease, you want to see what relationship exists between the two. So this research design you use for this also, it's different from the one you use for the previous two. And then when your question is causal or explanatory, so you want to know why it happens, why whatever happens. So in this case, you'll be testing some specific hypothesis to establish the causal link. So you want to know, for example, if you are maybe like in pharmacy, you want to see the effect of a particular drug. You want to know whether the new drug reduces sepsis mortality, or you want to see whether the drug is effective or not effective in treating some diseases or some situations, some health problems. So this is already a causal question. And you want to know the effect of an intervention on an outcome. So this is also causal. So for this, the kind of design you use, it's going to be different from what you used in the previous research questions, like descriptive, comparative, or correlational research questions. Now, let's now talk about various research designs that we have. We have quantitative research designs, we have qualitative, and we have mixed method. So for the quantitative research design, the first of it that I will mention is the experimental research design. And this is otherwise known as randomized control trial. So, and this kind of research design involves random allocation of intervention group and control group. So it means you get a baseline information about the study participant, and you randomly distribute them into intervention and control groups. And this is very useful in testing therapeutic efficacy. Not only in therapeutic efficacy, we can use this in social sciences too, can use it in public health research or social research. And so maybe you want to test the efficacy of a new drug. And this approach, this research design offers the strongest causal inference. You can make a causal inference from the findings that A causes B, or A and B causes C. So that's experimental research design. This is just an introduction. In subsequent training, so we could be going deeper into how this is done, what are the assumptions, and what are the other things that we need to do to ensure a successful randomized control trial. Another is quasi-experimental design. And this one is like randomized control trial. The only difference is no randomization is involved. You have two groups. You have your baseline data, and then you have your endline data. So, but the groups are not randomized. It just divide the study participant into groups. And a good example is a real world, policy evaluation. So like making smoke-free laws. So that's a quasi-experimental design. And then we have the cohort design, otherwise known as longitudinal design, although all cohort design are longitudinal, but in most cases, not all of longitudinal are cohort, because sometimes some longitudinal study may not actually be, completely cohort studies like that. So, and these design follow exposed, and whether you are dealing with exposed only, you follow them over time, or you are dealing with unexposed only, you follow them over time. So, and this approach is important when you want to know the incidence of a particular disease, or you want to know the risk factors of a particular disease, or the incidence of a health condition or health situation, or what are the risk factors. So cohort design could be very useful in dealing with this. And then we also have a case control study, or case control design. And this is a research design that compares the diseased, those who already have a problem we are interested in, those who have the disease, versus those who do not have the disease. So we have the case, and then we have the control. And those who do not have the disease, they're the controls. And this kind of research design is mostly used when we are dealing with a rare event or rare disease. For example, there are some diseases that are very rare, yes, they are there, but they are very rare. Some cancers, they are very rare. Yes, we will have them in the population, but you can't easily come by them. Maybe it's like less than 1% in the population. There are quite a number of cancers that it affects less than 1% of the population, let's say in Nigeria. So disease or like rabies and then some other cancers, or maybe cervical cancers. So they rarely occur. You don't find them in general population. So if you don't use case control study, if you use like a cohort study, or you use cross-sectional study that is based on a population, the prevalence in such method, the prevalence you're going to get may be less than 1%, and that is not going to make any good sense. So for anyone or any researcher to do justice in that kind of a study, it needs to use case control study or design. And then cross-sectional design, that's another, and this is just a snapshot. It's a research design that you have a snapshot collection of data, one single point in time. And this is very useful in measuring prevalence, in, you want to estimate prevalence of a particular disease or a particular outcome. So it is very fast, but then it cannot establish causality. So that is one major shortcoming of cross-sectional research. Now, talking about randomized control trial, it has various types. One of the types of randomized control trial is to have it in parallel, like having parallel group. So it means you have a separate intervention and control group. So maybe you carry out your intervention on the intervention group, and then you use a placebo, or you leave the control group. Maybe you use the traditional approach or a traditional method, or you just you allow them to get exposed to the usual situation, and then while you carry out your intervention on the intervention group. So that is parallel. But then there is also the crossover design in randomized control trial. And this is, of course, this is peculiar to some disciplines. It's not in all disciplines. For example, if you are, if one is dealing with a research that has to do with therapeutic investigation, so one might have to look at crossover approach. And in this approach, the participants are allowed to receive both the treatments sequentially, which means, yes, you have two groups. You have the treatment, you have the intervention and the control group, but you allow each of them, you allow both intervention and the control group to to undergo the treatment, the intervention. But then you are going to allow some washout period. And of course, it's most especially used when you are dealing with drug, maybe effect of drug on people. So that means you administer it on the intervention group, and then you allow a washout time, and then you also administer it on the control group. And then you look at the effect, pre and post for both. Then you'll be able to see. And the essence of this is to control for possible individual differences or reactions or other external factors that might be taking place in the study participant. And then we also have the factorial randomized control trial. And this have to do with a situation where you are having multiple interventions being tested. You have a placebo, and then you also have like more than one interventions. You want to look at like drug A and drug B, how does it, which one is more effective, and then compare to the control group. So, and then cluster randomized control trial. This is at a group level randomization, like randomizing a village or a community. So, when maybe randomizing individuals will not be possible. And then we have the adaptive approach, and it's a design modified based on interim data, and that's especially very practicable in vaccine trial for COVID-19. Just to be able to add some variants, maybe along the line as the research is going on, you modify, some of you modify some approaches that you are using, or you modify the vaccine or the drug, whatever you are trying to test. So now we go to qualitative and mixed methods design. I put the two together because over time, mixed method design have proved very, useful in handling complex research questions. So for qualitative design, one could use a phenomenology approach. That is the one that in the first experience of a phenomenon. And then you could also use ethnography approach, like in-depth cultural immersion. You want to look at the in-depth study of a cultural setting, so or a culture or the behavior of a group of people. Or so I think it's much more applicable in social research. So yes. So then we have grounded theory, and that is for generating theory from raw data, and case study as well. We also have case study, which is intensive study of a bounded system. It could be an individual, it could be a situation. I mean, it could be a community. It's a scenario. You study that scenario. You study the individual, and extensively. So that is a case study. Of course, this is not quantitative; it's qualitative. So the mixed method is the combination of both quantity and qualitative. Why the quality is trying to look at what is happening, and then how much is the situation, or how much is happening, what's the prevalence, how many people are affected. The quality is trying to look at how, when you use the two together, it allows a comprehensive understanding of the research question that we are trying to study. And when you are using this approach, since we are combining two methods, you could use convergent approach, you could use sequential, either sequential, exploratory, or explanatory, or you use embedded design, or you use concurrent design. So, for example, for someone looking at surveying, looking at maternal health, and then also looking at interviews on reasons behind the findings that you have as factors influencing the maternal health outcomes. So with that, if you want to look at the reason behind the finding, that is going to be a sequential explanatory. You are using the qualitative to explain the quantitative further. And if you do the qualitative first, maybe you want to develop some concept, you want to develop some construct, and then use the quantitative to look at the prevalence of that. So in that situation, you're going to be using sequential exploratory. design. So now there are quite a number of emerging methodologies that are coming up. They are kind of innovative design and that are now being introduced in the contemporary time. So, and one of it is the digital phenotyping. This involves continuous passive data from smartphones. You know, these are days that, you know, there are studies that are now being conducted on some behavior of people on social media. So there are some data that the smartphone store and maybe in the cloud or on the device. So digital phenotyping approach can be used to look at some of this approach. So we won't be going into detail of that now. So I just mentioned it just in brief. And then synthetic control method. And this is when there is no suitable control group. And for you to have a control group, you create a weighted combination of non-trivial units. So, and possibly you use the computer system, or you use some machine learning approach to do this. So, and then we have targeted maximum likelihood estimation. This involves use of machine learning, to establish maybe a causal inference. So, and then we have agent-based modeling. This is more like a simulation study. So, and it's becoming increasingly being used, in research. So you use simulation studies to inform empirical design. So, and it's especially used in complex system dynamics. And then you also have a situation where studies use citizen science. And this involves a large-scale data collection. And in this, there's a study that I learned about in UK, a study collecting data from a large number of people. The study is focusing on prostate cancer. And it involves about 80,000 people. And it's a longitudinal study, not cross-sectional study. It involves about 80,000, research participants. That's a very large, data. That's a very large sample, for that kind of, so it's a form of citizen science study. So quality control protocols, validation of subsamples, they're very important in such kind of a study. And then there are some key considerations we need to look at if we are using a randomized control trial, or you're using quasi-experimental research design, or any other clinical research design. And one of those considerations is the blinding. Blinding is very important, especially if you want to avoid observer bias. So in the assessment of the outcome, and especially this is useful in clinical studies. For example, if a pathologist is scoring tissue samples, it's important that the pathologist should not know which one is the treatment group or which one is the control group, because having the knowledge of that could, kind of affect the way the pathology will make the observation, we score the tissue, because it's having an expectation on the treatment group. So blinding is very important. That's just an example. And then randomization also important. It prevents systematic difference. It's important that we take note of that we randomly assign the study sample to avoid some group difference effect. For example, you're assigning mice, so you do it randomly to avoid cage effect. And then sample size calculation is very important to have adequate sample size to ensure adequate power, because once the power is low, the estimation will be unstable and it's going to affect the finding of the study. Then replication also, it's important that we confirm the reproducibility of the study. And when we do that, we can do this replication maybe in another laboratory or in another setting to be sure that this can be reproduced or is reproducible. And then the reporting standard is also important that we take note of the reporting standard. Now, looking at cross-sectional and longitudinal study too, we have some key considerations that we need to put in place. For example, the time dimension for cross-sectional is just 1 point. For longitudinal or cohort, it's multiple times. And then for cross-sectional cannot establish causality, while cohort can establish some temporality. So you can establish that there is a cause before the effect. And then the cost too, well, and this is very important, cost is lower when dealing with cross-sectional study, while cohort study, it's more expensive. And this is one of the reasons we don't have so many longitudinal studies in developing countries because of the cost. So, I mean, a large number of longitudinal studies or cohort studies that we have globally, we have a large portion of them in high-income countries. And then the attrition, and this is like a kind of dropout in the course of following up the study participants. This is not applicable in cross-sectional study, but in cohort study is a major issue because sometimes you cannot establish whether the dropout is as a result of what you are studying or as a result of other factors. So dropout is a major threat to cohort study. Some participants that started the study along the line, they cannot, I mean, they are no more, you know, they are lost to follow up. And with that, it affects the end line, you know, assessment. But then there are some new inventions too. You can look at missing data, do some missing data analysis, and then you'll be able to rectify that. But where the attrition is high, it's a big threat to cohort study. Then cohort effect also, this is confounded by age in cross-sectional, but this can be disentangled in longitudinal study. And we have a few examples. DHS is an example of cross-sectional study, demographic and net surveys. While for longitudinal, we have a good example of parent study. And the one I mentioned the other time, the example of the prostate cancer being conducted in the UK, using over 80,000, sample. Now, let's go to sample design. Sample design is also part of the research design because that also is important. We need to define it, and it involves most scientists, we are familiar with some of these designs. So probability sampling design, and this is chance-based. And then we have the non-probability design that is selection-based. For the probability, you could use simple random, just pure chance. You could use stratified. You divide the study population into strata, and then you sample from each stratum. And then you could have clustered sampling design. And for this, you sample from cluster rather than individual. This is mostly useful when it's difficult to sample individuals. And then it could also be systematic sampling. And then for the non-probability sampling, it could be a convenience sampling, it could be purposive, it could be snowball, that is participants refer others, and it could be quota sampling as well. Now, apart from sampling, that's selection of the sample size calculation is also very important because it ensures the study has enough participants to dictate a meaningful effect. That's one of the importance of sample size. And then also it helps to avoid underpowered study. So when there is underpowered study, there is a risk of missing the real effect. So it's important to have adequate sample size, but then one should avoid overpowered studies as well. When sample size is extremely too large, it also makes what is not clinically significant or what is not significant in real life become significant, like difference between 1 and 2. When the sample size is too large, we could find out that it becomes statistically significant, whereas in real life it's not significant. So, so that's why it's important to have an appropriate sample size. And one of the things we need in sample size calculation, you need to know the type of outcome, and the study design is important. The outcome, whether it's numeric or categorical, because it determines the kind of sample size formula you're going to use. And then what is the expected effect size or difference that we're looking at? What variability are we considering? The significance level that you are going to look at, and what power do you want to use, it 80% or 90%? And then you give room for some unspecified loss to follow up the attrition that we're talking about, or non-response rate. So here are some sample size calculations depending on your outcome. If the outcome is numeric, if it's categorical, if it's comparing two means or comparing two proportions. I won't be going into detail for all of this. And then when you are dealing with a matched data, a peer data or cohort studies or case control studies, there are different sample size calculations that you can use depending on whichever one you are using, or you're using a cluster, randomized, or surveyed studies. So now, in our research design, we need to also consider classification. We identify the variable and also classify it. The independent variable, and the dependent variable. So, but then between the independent and the dependent variable, what are the confounders? What are the mediators? What are the moderators as well? It's important to look at all of them together, to account for them. If we fail to account for them, it's going to affect the effects. You're looking at the effect of community health worker program on maternal mortality ratio. So you cannot examine the effect in isolation. You need to look at some confounders like baseline health infrastructure. So it's a confounder that could affect the program that is being designed. And then also there could be some pathway through which this program will work, and these are the mediators. Maybe like antenatal care utilization, antenatal care service utilization. That could be a pathway, because if antenatal care service utilization is low, even the community health worker program might not have the impact that is expected. So we need to control for that when we are designing the kind of study. And then there are some moderators, for example, like distance to facility. That could be a strength changer. It could moderate the strength of the association between the intervention and the outcome. Now, whatever design that we are using, we need to maintain some research integrity. And one of it is the internal validity. We need to ensure that the design is valid, the data we have collected is valid. So, and by internal validity, it means we have the confidence that the independent variable truly caused the dependent variable. So we need to be sure of that. And one of the threats to this internal validity is selection bias and attrition, or some histories. The way we can mitigate this kind of situation where we have such threat is to randomize or do some blinding or use control groups. And then we have external validity. And that's the confidence that the findings, it can be generalized to other populations, other settings, or other times. And sampling bias is a big threat to this, or having an artificial setting. Sometimes when the research setting is artificial, in another population where, or in the real world, in the real life population, or real life situation, the finding might not be the same. So, and when that happens, it makes the finding, the external the validity of the finding, difficult to establish. So, if we find out a particular association or make some findings in a population, in a setting, or at a particular time, we should be able to have that kind of finding in another population or in another setting. If it cannot be generalized, then there might be some methodological issues. Maybe method varies, maybe some situations or some variables were not controlled for. So external validity is very important. And for us to establish that, we must always ensure representative sampling, or you do a multi-site studies. And then reliability as well. And this is when the result, the measurement is consistent. Whatever measurement you have is consistent. For example, you're looking at blood pressure. So if you are monitoring blood pressure in a particular population, we have to ensure that it gives a similar reading on repeated measures. When we repeat it again, is the measure going to be the same with what we have previously? So consistency is important. Internal consistency is important. And for this, we can use a test-retest method. You can use inter-rater approach. You can use internal consistency to look at all of this to measure our reliability. Now, there are a few core ethics I want to emphasize in our research design when we are designing a study. First of all, we need to ensure informed consent of the participants, whether minor or adults. It's important to ensure informed consent, and also beneficence and justice too. We need to maximize benefits of the research, especially when it's going to be having some level of effect on the study participants. So in research, we should ensure that we always minimize harms done to the research participants and ensure a fair distribution to the study participants. And also, data protection is also very important. We should ensure anonymization of the data so that we will not compromise the respondents or the study participants' identification, so that people will not identify them, especially some studies that might, some findings that might lead to stigma. So it's important that we anonymize the data and then have the data in a secure storage. Then a few good principles, good practice principles. We have to be rigorous, be ethical, transparent, be critical in our study, and then we must be impactful. We should aim for evidence that improves outcome. It may be health, it may be another area. It's important to have an impactful research, because a lot of resources is being dispensed into the study. Now, as we begin to conclude, how do we choose an appropriate research design? If your research question, yes, largely your research question determines which one you're going to use, which research design you're going to use. If your research question wants to know whether X exists, so in such a study, you could be thinking of exploratory. Of course, usually if you want to explore, you use qualitative approach or you use descriptive approach. For example, you want to look at the unmet needs of undocumented migrants. That's going to be exploratory. You could explore, you are describing. And then if it is to know a pattern, you could use cross-sectional, you could use survey, you could use ethnographic. For example, what's the prevalence of burnout among nurses? That's an example. And if your research question is to examine association, you could use observational study like cohort, case control, cross-section. And if you are looking at causation, you want to establish causation, then you have to go for experimental study, or you have a strong quasi-experimental study. Experimental means randomized control trial. For example, you want to see whether Mediterranean diet reduces cardiovascular disease. So that reduction is a causation. So it's important that for such research question, we go for experimental design. And if you want to know how a particular variable causes the other, you're not just looking at causation, you want to look at how, then a mixed method is advised. Then if you are looking at evaluation, whether the intervention works or not, of course, you use randomized control trial, you use quasi-experimental study as well. And if you want to do a prediction, then longitudinal or machine learning approach would be the best approach to carry out the study. Now, apart from research question, research design also depends on feasibility. Can it be done practically? And then, is it moral too? The ethics, is it morally and professionally sound? And do you have the fund and you have the human resources to carry out the study? And then, how reliable are the measurements and conclusions? Very important. And then, can results apply to a broader population? Very, very important. So, on a final thought, yes, right. I'm rounding up. Thank you. Thank you. I'm rounding up. So on a final thought, so these are some checklists that should be considered when you are designing your research. You ensure your questions align with the research design, get validity assessment, feasibility verification, very important, ethical compliance, then analytical readiness and quality assurance. They are very important in research design. Thank you for the opportunity and thank you for listening. So, questions?
Thank you very much, sir. You did a lot within the time available. We are indeed really grateful taking the time to go through all of this. But then without wasting our time, I think I want to invite Professor Babajide for his reaction, then the TBC very quickly.
Yeah, thank you. Thank you, Dr. Mobolaji, for this introductory aspect of this particular presentation. Well, I can see that you still have so many things that you want to say, but for time, definitely it's introduction, so you have opportunity to come back next time and then continue with the presentation. So I want to thank you most especially for this one. And so maybe we present you, we slate you or schedule you for another presentation very soon. So we'll let you know so that people can enjoy your your research design, expertise. So well, I don't know what to say now. I just want to say that what you have presented today is so comprehensive. Maybe a little bit above what I can say is introduction, because you have delved into other aspects of the area that but I think it's something that is very, very good that people will be interested, in. So thank you so much.
Sir.
Thank you very much, sir. DVC, sir. You can omit, sir. Professor Kamil, sir.
Maybe we can go to question if he's not available.
All right. So we'll try to look into maybe if you can answer one question then. Dr. Mobolajis, I want to ask if you would be willing to take us again next week so that we can start with the questions that we have in the chat today. And then you can then properly maybe take us through other aspects of this next week, sir. Is that fine by you, sir?
Next week.
Yes, sir. Same time, same place.
I'm not quite sure yet. I think I'll give you feedback later.
All right.
I'll
Okay,
look
sir.
at my and then feedback.
All right, okay. Because we are at 8:58 already. I'm not sure if we would be able to take any of the questions that we have now, because of the time.
We can
But
if it's one, we can take one. Then
all right, okay, so let me quickly read one of the questions, sir. Fahidat, are you able to help check these questions? I'm struggling with pulling it up from my end. All right, I see one. It says, can we control for confounders like the baseline health infrastructure? The audience will benefit if the presenter can give a good distinction between mediator and moderator variables. So
okay,
that's yeah. Thank you.
Thank you. Yes. In research, many times when we sit down in our office or in our room trying to design it, that is just on the table. But in the real life, in the real world, it's not like that. There are differences, there are variations. So to control for confounders like that, sometimes you might have to use stratification. That's one way of controlling for confounders. You might stratify, okay, because if you are checking the impact of a program on the outcome, maybe like maternal mortality, ratio, like as the example I gave. So it's possible that some population or some communities have health infrastructure, whereas other communities do not have health infrastructure. So it's important to control for that, because those who have adequate health infrastructure, you might have the feeling that your program, so those who have adequate health infrastructure, possibly they utilize healthcare services more, and then they have lower maternal mortality ratio. And you might think it's your program that is bringing about that impact, whereas it's the fact that they have some inadequate health infrastructure, which the other group or maybe the other study participants do not have. So it's important to control for this. You can do some stratification. At some time, there are some you control for at the level of the analysis, but you make sure you collect that data. You collect you have the variable, because if you don't have the variable, you can't control for it in the analysis. So that's one way. Then moderator and mediator. Moderators, they are like individual differences that can mitigate or that can affect the strength of the association. Why moderator are like, a mediator, they are just like pathways. So if this will happen, what are the pathways that could contribute to that? The pathways through which it could happen. So they are quite different. And if someone is looking at maybe is using cross-sectional design, for example, socio or background characteristics of the study participant could be the moderator, where some other factors, some behaviors could be the mediator variable.
Thank you very much, sir. We want to appreciate you for taking time to take us through this. I think that's about the only question. The other one you answered it during the day. We want to encourage everyone to go to the YouTube page of the office. That is the OAU Central Office of Research on YouTube. This is also being streamed on YouTube, and we have close to over 20 participants the last time I checked. YouTube also who are listening and following. So the lectures are there. All you need to do is visit the page and click on the live section. You will see all this lecture and all our past lectures also in that on that page. So you can have an opportunity to watch these over and over and over. And if you have questions, you can always reach out to us at the Central Office of Research, Obafemi University, Ife. So we apologize again to our participants who are French, who would have preferred to have a French translation. For our subsequent sessions, we will activate the closed caption in Zoom so that you can always get your French translation once you join. So thank you to everyone for being here. Thank you everyone for joining us, and then you can also share and subscribe our YouTube page so that more people can have access to the wealth of knowledge that is on that platform from the Central Office of Research. So on behalf of the Deputy Vice Chancellor, Research, Innovation and Development, Professor Akoni Akiemi, the University Research Office Director, Professor Babajide Odu, and Professor Niron Luaranti, that's the Director, Linkages and Partnership, and Director, Intellectual Property and Technology Transfer Office, Professor Grace Ogunlesi. We want to thank you for being here. And of course, we also want to appreciate you because this is jointly organized by the Central Office of Research, Postgraduate College, and the Postgraduate Student Association. And all of us are saying thank you so much, Professor Bombalaji, for taking us through this section. We hope to have you once again at another time, and then be able to take you, be able to listen to you on maybe either this topic or some other topics. I want to appreciate everyone for being here. I want to say thank you, and we hope that you will join us again next week, same time, same link, and then of course we'll be looking into we'll be taking some aspects of this research design that has been introduced, to going deep into some of these sections, and we'll be very practical, in the way we go through them. So I want to thank you once again and say, see you next week, and please have a great day. We apologize for going over time, but it is for a good cause. So see you next week, and bye bye, everyone.